Hello and welcome to Health Professional Radio. I am your host, Neal Howard. Thank you so much for joining us today. Iodine's main role is to help manufacture thyroid hormones. So says our board-certified internist guest today, Dr. Jake Teitelbaum. He says that's why a subclinical iodine deficiency, enough to prevent a goiter but not enough for optimal health, can cause hypothyroidism. How are you doing today, Dr. Teitelbaum?
Doing great, Neal. How about yourself?
Doing well. Now, you are the director of the Practitioners Alliance and also one of the most frequently quoted integrative medical authorities in the country today, and the author of the best-selling Fatigue and Fibromyalgia Solution, as well as the developer of the smartphone, a free smartphone app, Cures A to Z. Hypothyroidism. Well, what is the difference between hypo and hyperthyroidism?
Well, basically, thyroid is like the body's gas pedal.
Mm-hmm.
It's basically, like the thermostat in your home that sets how much energy you burn. So if the thermostat is stuck on being too low, you're in the middle of winter, your house is going to be very cold. If it's too high, you're going to be sweating. And the same with the body. If you're making too little energy, you're going to be tired, achy, weight gain, cold intolerant, and a host of other symptoms, including infertility and many, many other things. If, on the other hand, it's too high, you're going to feel like you've had too many pots of coffee. Palpitations, racing heart, arrhythmias, confusion, anxiety, and a host of other symptoms. So if you think of it as when people come in to see you, to the doctor, it's important to realize that the blood test will miss the majority of people who need thyroid hormone. This has been shown in a number of studies. And unfortunately, where the TSH level used to be perhaps a little more helpful, a number of problems, including not only the drops in iodine levels, but also having competitive inhibitors such as fluorides and bromides and dozens of other chemicals have been shown to
Now,
thyroid.
if I can interrupt just a moment, you say it's widely known that the majority of tests will miss the fact that a patient needs their thyroid problem addressed. Why have there not been any tests made? I mean, they update drug tests, don't they? So why not hypothyroidism?
Well, because the thing is that first of all, it's known, it's not widely known, but the research has shown that the majority of people will have normal thyroid. But here's the problem that's going to see, Neal, that what if, say you wanted a shoe size test. You wanted to test to figure out if people's shoes fit. Mm-hmm. How would you do that? We'd get a shoe size, and then we'd do what's called two standard deviations. We check 100 people, and the 95 in the middle would be the normal range, mm-hmm. and the highest and lowest 2% would be defined as abnormal. And that's what most doctors don't realize, is that the normal range for most lab testing, and it's the same also with the thyroid, comes from two standard deviations. They take 100 people, and the highest and lowest 2.5 are defined as abnormal. Now, let's use shoe sizes again as an example.
Okay.
A normal range for shoe sizes would be 5 to 13. There would be two standard deviations. Now, say you wanted to make a test that told you if anybody's shoes was big or small, and you try to do it by just assigning a shoe size, mm-hmm. it wouldn't fit. I could have a size 7, and the small petite woman it could be too big on her, and I'd give you the size 7, and you'd say, well, I can't get my foot in this dang thing. And so just like that, thyroid is not a one-size-fits-all. And unless you take the test and then also apply it with symptoms, how's your energy? Are you tired? Are you achy? Do you have weight gain? Do you have cold intolerant? Are you having infertility? Are you constipated? Unless you look at the accompanying symptoms, just like shoe sizes. Does it feel too tight? Is it falling off your foot? Mm-hmm. If you don't ask these questions along with the test, you will miss most people who need thyroid hormone. I will tell listeners right now, Neal, mm-hmm. if you have a person who is feeling miserable with pain and fatigue, and you say, well, gee, your thyroid's normal. It's right on the low end. It's 0.7, when normal is 0.7 to 1.8. So you say, well, this is fine. I'm going to tell you as a doctor, you are doing harm to that person. You're increasing the risk of heart disease by over 35%. You're increasing the risk of developing Alzheimer's. And I will recommend that you wear a size 6 shoe till that person's next appointment. And then talk about the wisdom of, well, if it's in the normal range, it's okay. That's not what the normal ranges mean.
Now, when you were talking, you mentioning infertility. Are we talking infertility in men and women, or are we talking the inability to conceive or erectile dysfunction? Are we talking about the entire gamut of reproductive health?
Mostly in women.
Okay.
And it's when you see women with unexplained infertility, very often, if you give them some thyroid hormone, then they will conceive.
Okay.
And you'll see that many labs will use 5 roughly as a level for TSH. So if the TSH is under 5, they do it as normal. Many researchers will consider anybody with a TSH over 2.5 to be abnormal and hypothyroid. And what I'm going to recommend is that no side is right in this. And what you do is you add the symptoms. If the person feels great and their TSH is 3.5, well, why were you checking in the first place? But if the person feels tired, achy, waking, cold, intolerant, constipated, they have any 2 of those symptoms, they deserve a trial of thyroid hormone.
What about thyroid medication? Always recommending medication, or can we offset some of these symptoms with diet?
Well, iodine can go ahead and help. And again, what I'd recommend, it's hard to get everything they need from the diet because most people don't eat enough seafood. But if they take 6.25 milligram of iodine, you can get it in a capsule called Tri-Iodine. Take that for 3 to 6 months. It will replace their deficits. And then I recommend they use a multivitamin. I like one called the Energy Revitalization System vitamin powder, where one drink covers 35 different pills. It makes it really easy and low cost for people. And then people are covered, and they have what they need, and they don't really have to worry about it. But also with thyroid medication, this is not a one-size-fits-all. Some people do better with Synthroid. Some will do better with Cytomel. Some will do better with a combination of the 2, or even using things like desiccated thyroid. Many people with low thyroid have problems not with the production of thyroid, but the conversion in the periphery of T4 to T3, and the test will not show what's happening in the periphery. So it takes listening to the person combined with a clinical trial to see how they respond.
Now, can you have hyperthyroidism that develops into hypo, or vice versa, or once you have one, does it remain the same?
No, people will often be on a roller coaster because what happens is you'll get inflammation or autoimmune disease that will cause the thyroid to become irritated, spilling out thyroid into the periphery, and they become hyperthyroid. And then the inflammation becomes quiescent, and now the thyroid's been damaged and it's underfunctioning. And then the inflammation comes back, the autoimmune stuff comes back, and they go hyperthyroid again. And you'll see people on this emotional roller coaster between high and low. And I will give people a standing order, not for TSH, but for a free T4 blood test, that when they're having the symptoms, they can go in that day and have the blood drawn. And you'll be surprised to see how often it goes on the upper side of normal, the lower side of normal, or even beyond the normal range, beyond it, where they're in the highest to lowest 2% of the population, in correlation with the symptoms. And you often have to follow it to treatment. The nice thing about iodine at higher doses is that it will help, low thyroid at 6.25 milligram in people. But people who are hyperthyroid, if I'd give them over 12 to 15 milligrams a day, it will start to block their thyroid. That's one of the best treatments for hyperthyroidism. Although you have to be careful initially, you can boost it before it drops it. But that you can get double duty with the thyroid, and over time it will tend to normalize and balance thyroid function.
Once someone goes to their physician and says, "Hey, I've been feeling fatigue, sweating at night, or cold in the summertime," any of the combination of these symptoms that we've discussed, once these symptoms manifest, how long has a person usually had a thyroid problem? And can we, jumpstart the test long before symptoms ever appear and catch it early?
Sometimes you catch it early. Sometimes a person has had it for 30 years and it's totally destroyed their life, but been missed by their physicians who have relied on the tests and ignored the person in favor of tests that over time are shown to be unreliable. But it doesn't matter how long the person has been ill or had the low thyroid or the high thyroid. Some damage may already have been done. They may have the heart disease and a heart attack, but you can get them feeling quickly better overall by turning their energy production back on. It doesn't matter how long the thermostat's been low. You may have frozen the pipes and caused damage from leaving it low too long, but in most people, to turn it back on, and the house is a nice 74 degrees.
Now, your book, The Fatigue and Fibromyalgia Solution, can we get a copy of that at your website, vitality101.com?
If you just go to Amazon.com or most bookstores, would be the easiest place to get it.
Thank you very much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Jacob Teitelbaum, author of the best-selling The Fatigue and Fibromyalgia Solution, and also the developer of the free smartphone app Cures A to Z. We've been in studio this afternoon talking about hypothyroidism and the seriousness of that condition. It's been great having you here with us today, Doctor.
Neal, a pleasure.
Thank you. Transcripts and audio of this program are available at hpr.fm, and you can subscribe to our podcast on iTunes.